Thanks, John. I suppose I represent the insurers on the Fit for Work coalition. I suppose companies like Irish Life were well known for provision of pension benefits, but the provision of disability insurance or long-term income protection is also a very important product provided by the insurance industry, and we cover up to 700,000 people in Ireland. That's the industry as a whole for income protection benefits. I suppose the way our cover works is it's typically if you're out of the workforce for more than 6 months through illness, if you're deemed unfit for work, you will qualify for sort of income replacement. And broadly, the type of people we see, I suppose, fall into 3 categories. Typically, we will assess people just before they're 6 months out, so they may be 4 or 5 months out. About 20% of people we actually deem fit for work, so they don't qualify for benefit. And that's certainly the toughest part of our business, because these are people that feel they should not be in work, but I suppose our independent medical assessment is that they are fit for work. So that is a very, very tough and is the hardest part of our business. There'll be a proportion of people then that will qualify for benefit for a period of time, but will recover from their illness and will return to the workforce. In a lot of cases, insurance companies are able to help those people with rehabilitation programs, and certainly where we can do that and return people to the workforce, that's the most rewarding aspect of our work. And the third category of people then, I suppose, are people who have more severe illnesses and, will be out of the workforce indefinitely. And for those people, we continue to pay benefits typically until they reach the retirement age of 65. And again, I suppose that's probably the most valuable part of our service, because, long-term illness where you don't have insurance cover is one of the primary causes of poverty now in Ireland, so that is very important cover that we provide. I suppose the 2 things we've seen over the last few years are, one, a big change in attitude that actually being in the workforce is a good thing. When I started off, I suppose the feeling was if work was a necessary evil to get money to get by, and somehow if you could get the money in an easier alternative way without working, that was a good thing. That attitude has changed now. Like, people link activity and health very much together, and there's a whole sort of social inclusion side that's accepted now. That comes from being in work. So being in work is seen as very, very important, but there's been a significant attitude change on that. I think the other issue is just the importance of early intervention. So again, this is seen as very, very important. And I suppose with all of the things we're talking about, like, there are 2 aspects to this always. There is an absence management aspect, and there is a sort of tough love aspect to all of this. And then there is, I suppose, the importance of early intervention itself and providing the proper services to people that need them. And I think the 2 initiatives that are being recommended today link into both of those agendas. I suppose, one, if we do accept and acknowledge that work is good for you, I think there needs to be a tougher transition in going from your salary to qualifying for illness benefit, and that's what feeds back to the certification process. I suppose there's initial certification just to the employer to show that you're out of work, but then there's the certification to qualify for illness benefit from the state, and arguably that coming in at 3 days through GP certification is a little bit soft and probably needs to be tougher. And then I suppose there's some more substantive intervention that's needed maybe after a period of somewhere between 4 weeks, but certainly not later than 3 months, where there's a more robust assessment and gives, I suppose, information that's more useful back to the employer. And I suppose it's just figuring out a way where some infrastructure can be put in place for that, and that's what I suppose the case management service attempts to address.
Thank you, David.